Hello दोस्तों, today we have come to another interesting episode of podcast on neurological development anomalies in children. Autism, नाम तो आप सबने सुना होगा, but did you know that as per WHO, out of 100, 1 children globally suffers from autism. Not only this autism and ADHD in children are often remain undiagnosed until late age, but the parents keep on suffering along with their kids. So to decode all these anomalies and to know what should be done and what are the prevention steps, we have with us Dr. Panna Sharma, consultant neuropsychiatrist. Welcome, doctor, to our show.
Thank you for welcoming me. I am really excited to enlighten the people on this topic because this is really very important topic for the people to understand, as there is lack of awareness on this, and early intervention can help a lot to these children.
Yes. So, doc, as we have already discussed, like what is autism, and could you tell our listeners in a layman's language what is autism and what is ADHD?
See, both of these are actually neurodevelopmental disorders. So, neurodevelopmental disorder means this results because of some changes in the brain. So, talking about autism, in autism there are some changes in the brain areas which are responsible for social communication and all. Like there are changes in the insular region, then anterior cingulate cortex, amygdala, and hippocampus, cerebellum. So all these parts are involved social interaction, communication, emotions, and the cognition part. So there are changes in those areas, and not only the structural changes, there are also studies which talk about the deficiencies, or there is increase in some of the neurotransmitters. So there are studies which talk about serotonin, then there are studies talking about dopamine and noradrenaline also. So because of the differences in those neurotransmitters, such condition comes. And talking about ADHD, in the frontal cortex there are some transporters are there, like dopamine transporters, norepinephrine transporters. So there are issues with those transporters, because of which there is lack of dopamine during that time. So the children keep on shifting from one task to another and carry on because they don't get the dopamine at the time. Along with that, there is decrease in GABA also. So GABA is a neurotransmitter or chemical which actually leads to inhibition of the activities. So as they are deficient in those neurotransmitters, so the inhibition doesn't occur. So there is very impulsivity or hyperactivity, or those such behavior can be seen because inhibition is not there. Along with that, there are other neurotransmitters, same serotonergic and glutamatergic thing, which are either increased or decreased. So because of all those changes, people have ADHD. So basically in both the conditions, if we see the balance between the areas, the connections between the areas, and the functioning of the neurotransmitters or the functioning of the brain areas, they are deficit, not like other normal children.
Like in normal children or maybe in any adult, if the quantity or maybe the quality of the neurotransmitters like serotonin, dopamine, and maybe all the neurotransmitters like GABA, they are maybe deficient, production might be deficient, or so that their mood will be irregularized, right? They will feel a tendency not to get rewarded sometimes, so they will tend to hyperactivity. That's what we can, all these things attribute to our mighty brain, I guess.
Yeah, matlab if I talk like in a layman language, and it will be like chemical reactions are not going on properly in the brain.
Chemical locha hai brain mein dosto. Yeah. So we should take it seriously before definitely. It gets too worse. Okay. With this talk, I would like to ask, are there any such signs and symptoms that a children might have autism and ADHD both, or they would exist separately also?
Yeah, see, the symptoms are different in autism and ADHD both. Like in autism, the actual problem is all about the communication. The social communication is not that much, and the language delay is also there. Along with that, there are some repetitive behavior is there, some restrictive behaviors are there. Whereas in ADHD, they will have hyperactivity, they can have inattention, there will be some impulsive decisions or impulsive behaviors. Now, in some cases, a child can have both autism and ADHD. Like in studies, they talk 40 to 70% of the autistic kids have ADHD too. So comorbid diagnosis can also be there.
So when the both anomalies occur together, I think this case would be more severe and difficult to treat.
Definitely.
Oh, one doubt I'm asking on behalf of the parents out there. Sometimes parents complain, my child doesn't listen to me. My child don't pay attention what I'm saying. Either they were busy in playing or doing whatever the activities. Is this a short characteristics of autism and ADHD, or there might be as normal as they are inattentive, not listening? Maybe the child is busy in his or her activities.
Now we have to see that for that we need to assess also. For example, if the person is having ADHD, that is the child is having ADHD or child is having autism, so initially not only that in autism, if you call the child by the name, they will not listen to that. It will not be one or two case. It will be persistently, it will be there. The communication, social interaction will be poor. But whereas in other children, maybe one or two occasions or instances may be there where the children is not responding when you are calling the name, or there can be some auditory problems too. So when we come up with children with autism, initially we do the auditory assessment. Maybe the child
ear problem.
Ear problem. Maybe the child is not hearing. So how can we say that the child is not responding because of autism?
Okay, so in cases you have seen in your practice, like there are children whose ocular part is not that much developed because of the neurodevelopmental anomalies along with autism. Yeah. Okay, so
no, but not that with autism, not necessary. There can be any ear anomaly. But we need to rule out that the child has proper auditory functioning so that we can go for autism. Because if someone can't hear and if you intervene in that, maybe the child will develop normally. So that will not be autism. That will be that the child has only auditory issues which has been taken care of.
Right. So with this, we'd like to ask, what are the common signs and symptoms you see in autism and in ADHD, in short, if you could?
In autism, even from infancy, we can see some changes. Like we talk about the temperamental issues. So as we see, the milestones develop, age-wise. Like 3 months infant, they will react. They will have a social smile. They'll make eye contact with the mother.
They will able to perceive that it is my mother or maybe father or maybe it's an individual.
Means they will react to the environmental cues as well.
Right.
Okay, but in autistic child, they will not react much. They will not make eye contact. The social smile will be lacking, and gradually when they grow up, then you can see some repetitive activities may be there. Like at one place, they may be moving round and round. They may be moving their hand, and they may be piling up things together. They may be following some restrictive pattern. Like some kids are very much attractive to suppose a color, specific color, maybe it yellow or red, and they will always wear that type of clothes. They will be playing with the toys which are red in color. So specific color or food. Suppose they like a specific type of food, they will always
demand
that.
for that.
Yeah. It is very difficult for a autistic child to adapt to change.
Stubborn nature might be seen in some children.
Yeah, stubborn is a bit behavioral issue. But in those kids, they they don't understand the emotional cues. They don't understand. They are very particular about the things. It's not that they are doing it purposely. But it's there.
Unintentionally this
it's like you talk about a phone which is not a smartphone. So if you're not using a smartphone, you can't have the touch facility, right? So it's like that. So the child has this issue inbuilt in that. The brain areas are changed in that manner that they are like that. So even if you're crying in front of them, they will not understand how to react to that. Like soothing use, those emotional quotient is missing. And in ADHD, it's a bit different. Like in ADHD, the child will be very hyperactive, cranky, very impulsive. You will try to calm the child, but the child will be crying, going here and there, not sitting calmly. And every time, they will not complete a task. For example, they will not finish the eating. Suppose they will have a bite, do and jump to some other activity. So it's very difficult to make the child calm and sit and do whatever the child was doing.
They get bored quickly, na?
Yeah.
They need immediate some change of task and
Yeah.
change of things. And one patient I have seen, like the child was really it was hyperactive, and along with this, whenever he sees toffee, chocolate for say, they go like nuts. I need this only, and until and unless they get the toffee or chocolate or whatever, maybe a toy, maybe for say in shops, they will keep on crying, banging their heads and whatnot, rolling in the floor, swimming from there. So
this is what stubbornness is.
Yes, this kind of behavioral is can be correlated to ADHD.
In ADHD, such behavior is seen because they are very impulsive. For example, they right now they want maybe aeroplane. They will not play with that. They will play for some time. They will break it also.
Okay.
If they are angry, they will throw it out. So some have the inattention part more. Some have the hyperactivity part more. Some have the impulsivity part more. So that is why even in diagnosis also we make a separate diagnosis, like ADHD. It can be hyperactive type, inattention type, like that, or mixed.
Okay. Thank you for all the signs and symptoms that we could learn from you. Like with this, are there any causes to it? Like any genetic causes? Does genetics play a role in development of these diseases? I should say anomalies. And are there any environmental factors attached to it?
Yeah, definitely. See, there are so many studies, like the genome-wide association studies are being done to find out the genes which are responsible for these causes. So like in autism, there are some genes which are identified, some chromosomes which have been identified, but they are not very specific. There is too much of overlapping between the genes which are identified, because for example, the same gene is there for depression also, anxiety also. So we can't say specifically that this gene is responsible for causing autism or ADHD. And secondly, if we talk about the environmental factors, then there has been studies in which maternal smoking, using other substances like alcohol, cannabis, and then exposure to organophosphates and pollutants even, they can cause such symptoms of autism and ADHD. So maternal health is also very important. Even mothers who have diabetes and or have seizure disorder and are taking valproate or even other psychotropic medications, they can also have autistic kid or ADHD kid.
Okay, that means the prenatal health of the mother is very important.
It's very important.
And one should take care their health and should get rid of the medications before planning or conceiving for kid. Because these psychotropic medications, as you have mentioned, could be one of the possible factors for having autistic kids. Yes. So with this, how modern medical science has some diagnostic tools, or you say biomarkers, anything, how diagnosis of autism and ADHD is done in children?
First of all, you need to identify the symptoms and go to a specialist. Then after that, there are some tools are there, talking about scales are there. So the scales are applied on the children. So there are two types of scales. One is for screening and one is for diagnosis purpose, and in that severity can also be identified. So based on those scales, we make a diagnosis along with our clinical interview too. So after that, the diagnosis is being done. But we are not fortunate enough for any biomarkers or any investigation like CT or MRI to say that this is the finding which is like confirmatory for the diagnosis of these two disorders. But it's all about the scales and the clinical interview.
The doctor, the expert in this field, like neuropsychiatrist or psychiatrist doctors, are able to diagnose it, and you should visit whenever you find any signs and symptoms as said by ma'am. So with this, ma'am, I would like to ask you, like, for what are the basic steps, or I should say basic alarming signs a parent should look into their kid so that they could take and seek medical help at the right time?
Okay, so when they see the changes in the child, see what happens in both the disorder, there are some behavioral changes, like what I told, the kid will not, in case of autism, the kid will have language delay, the kid will have problem with the eye contact, social smile will not be there, or they will not be interacting much socially, like they will not play with the children of their own age. The child will be found to be isolated.
Isolated.
And along with that, there can be some sensory issues too. Like with noise, they may be shouting, they may be crying, too much sensitive to loud noise, too much sensitive to touch, or maybe less sensitive to touch or all that. So the sensations may be different in those kids.
And delay in speech also.
Yeah, delay in speech.
Any particular age you want to just give an idea to the parents, like at what age until up to this, if the signs, whatever you say, sensory touch, sense of smell and everything, speech, vision, social and emotional attachment, if this doesn't develop up to say age of, I'm saying a random age like 4 years, 5 years, 3 years, what should be the age up to this parents can wait, but after this they must seek medical help to rule out the causes?
For autism, you by 1.5 years or max to max 2 years, you can find out these changes. And like by 1 year, if a child starts speaking, by 2 years, if the child is not speaking, then that's a red alarm. So at least by 1 year, wait for at least 2 years, but not more than
Not more than that.
Yeah, and in
Yes.
case of ADHD, till 3 years you can see the behavior of the children, but it's still persisting. You are getting frequent complaints from even the teachers that the child is very inattentive and very hyperactive or impulsive behavior. You can see, then you should go and visit a psychiatrist.
Right. Okay. With this, what are the common misconceptions, I should say, like common myths around us you have seen in your practice while dealing with patients with ADHD and like autism and any other neurodevelopmental or animal issues?
Oh my God, there are really so many misconceptions.
We'd like to know.
Yeah. See, there are two groups. Okay, so one is like normalizing the behaviors, and the other group will be showing critical comments or hostility towards this behavior.
Okay.
So in
the patients itself or the attendants?
the patients, no, not the patients family members.
Okay, family members. Okay,
Yeah.
my God.
So normalizing in the sense that suppose an autistic child is there, my bacha is introvert, not speaking, he doesn't talk to people, he likes to stay
alone in a room
Yeah.
or something.
And this is normal. My bacha is very shant, they say like that. So what's abnormal in that? And in case of ADHD kid, every child is very shaitan in their childhood. What's abnormal in that?
Okay.
So gradually the child will become fine. And another group is like, see, both the conditions are very commonly seen in boys. Okay, it's more than girls. So, and then in the critical family members, they'll be like, what kind of guy is this? He's not talking. Matlab, I have produced a namard. Like that, they will say.
The critics kind of the third category you are saying.
Yeah.
Oh my God.
Then the ADHD kid, most of the kids of ADHD, they are punished in the school by family members. They'll be beaten. Okay, why are you not sitting? They will start, beating the child, and the child will be like, helpless. I am not doing it.
My own.
Yeah.
तारी ज़मीन पे ना movie उसकी याद आ गई बताओ सच में.
Yeah, that's what. So people don't understand. Now, when this kid grows and becomes an adult, then the family members find only one solution: shadi. Marriage is one of the solution for both the problems, and after that, actually things worsens.
Yeah.
So,
do you think personally like it works?
no,
This
it does-
marriage
no,
thing?
No. See, as I told in the initial, it's a neurodevelopmental problem. How can marriage help in that?
Yeah.
And second is that they will go to faith healers, they will try all the dhagas, they will try all the totkas, they will try everything possible, but they will not visit a psychiatrist even if they are told. Like I went to a school for awareness program. There the special educator told me that I try to educate the parents that your child is having this issue, so you need to come and show a psychiatrist, and then we will start the program, and then we'll help the child. They are like, why psychiatrist? Is he mad? He's not mad. There is no signs of madness. I will rather change the school than
Instead of visiting the doctor.
Yeah.
My God, they have so much stigma around it. Yeah, trust me, like I have even heard this kind of stories and I could totally relate to what you're saying.
Yeah.
Because people have a stigma that only mad or mentally totally disabled persons go to psychiatrists, but this is not the case, listeners. You should visit and give your health. Mental health is equally important along with the physical health, and give your health in safe hands like doctor.
And just to mention one thing, like autism doesn't mean everyone will have low intellect. There are also high intellect person with autism, so that's the Savant syndrome. So such kids also come, they clear. I have a patient from IIT, so that person has mild autism. So in adulthood he is having problem with interaction with the boss. In marital issues are coming up. So all
Right.
his life he was a good student, and parents were like, "Ki, my bacha is a bit shant
Shant
bacha."
bacha.
So that ignored the actually autism diagnosis.
Right. Even I should say I know few people personally who are very highly intellectual being, and even some researchers, as you just mentioned, in IITs have gone to IITs. Even the kid I know, he has cleared some Olympiad national level. Yeah, they're highly intellectual being, but the social connection, that there comes the like little bit of they're offbeat there. So yeah.
And actually intervention can help.
So what are the treatment options available?
Okay, so for autism there are no such medications. There are no such surgeries, there are no such investigations which can cure autism. It's all about the therapy. So you have to go for occupational therapy, behavior therapy, and there are some upcoming therapies of like oxytocin therapies there, where they give oxytocin, but still studies are going on.
To
People
increase the emotional attachment, and because oxytocin is a love hormone, like they would feel good and loved and something.
they'll understand. It has been seen that their emotional cognition, those part have increased.
Increases,
But still it's under study. Then
Okay.
there is a stem cell therapy also, but it is also under study, because along with stem cell therapy they are also undergoing occupational therapy. So we don't know that from
Which one is working? Yeah.
So those who are giving stem cell therapies, they are talking that's very beneficial, but still we can't say.
Yeah.
Then neuromodulation is also there, like RTMS, TDCS. Those things are also being tried, but still there is no specific evidence. In some studies, they have found improvement in the cognition, because the areas of brain which is not that much stimulated, with the help of neuromodulation, will stimulate those areas. And in ADHD, medications are there, but and along with that, now it depends. If it is moderate to severe, we prefer medications. If it is mild, then you go for behavior therapies. Yeah. And in autism, some cases we need to give medications, like if there are comorbid other mental illness or comorbid ADHD is there, or they have behavioral issues. Like in some cases of autism, they have irritability, they have aggression.
Right.
So in those cases, we need to give some medications to calm them down.
Doc, could you just guide us how the course of this disorder progresses?
In autism, if intervention is done, gradually the social interaction and all these things will improve. But in ADHD, with age, when they enter adulthood, then 1/3 of the symptoms remit. That is, 1/3 of the ADHD children, they become fine. But rest of the children, they can have other issues. Like some can have personality disorders, and some can have bipolar, some can have anxiety, some may go into substance use. So it will depend on the children per se, not it's not specific that this children will enter into this
zone.
Yeah.
Okay.
Because some have conduct disorder also along with ADHD, so they can be having antisocial personality disorder also, along with substance use maybe. So
okay. And one more thing I'd like to ask, like if treatment is started, or any for say medication or any therapies, how long it takes time in general, any just an approximate to show results?
there is no specific time actually, but for ADHD the medication will start working within a month. But for therapy it takes time, because it's like intervention, homeworks are given, how the parents are doing the homework at home, how they are teaching the child, how they are communicating, everything will vary. But for ADHD the medication starts working within a month. You can see there is some improvement. And even in autism, if there are some behavioral issues, with the medication within 2 weeks they will start showing improvement.
Good results. And in therapies, if taken like for a prolonged course of time, would help more.
Yeah.
One more term that I have heard, just to confirm you, like dyslexia. Our autistic child, some are intellectual being that we have discussed, some might not find interest in studies at all, and maybe it's not their fault. Give the credit to the brain. Like these dyslexic persons, are these also seen in autistic child, or these a totally separate like mental illness that you should tackle as a psychiatrist?
Dyslexia is a specific learning disorder. There is dysgraphia, dyscalculia also. In that, people have difficulty in reading, writing, all these things come. So yeah, specific learning disorders can also be seen in autism, but not it is specific that autism hai to dyslexia or specific learning disorder it will be there. It's not like that.
Might be, might not be, depending on the patient to patient. Okay, so like as you've said, that might be some auditory problem along with this. So speech therapy would also be beneficial in case the patient has this like speech disorder something. This.
Yeah, the most important problem is that they have language delay. So that is why we need to give speech therapy to autistic kids, so that they start talking for that. But if they have, auditory problems, if along with autism, then definitely for auditory problems they need to have some other intervention.
Maybe medical surgery might be
Yeah, or maybe some other, machine auditory purpose.
As you've rightly mentioned that there is no like medication and surgical interventions for autism. So are you getting any requests such as a medical professional like madam कुछ तो कर दो मेरे बेटे को अभी कुछ इंजेक्शन दे दो कुछ तो गोली दे दो like बेटा बेटी whatever their kid is हम कुछ तो कर दो ठीक कर दो. Do you get some requests?
Yeah, we do. The first thing is they come, see, in this cases, actually they will visit multiple doctors.
Okay.
Because they think that something the doctor is missing. So first of all, they will say, doctor साहब CT scan करवा दो.
अच्छा.
Then they will say, doctor साहब कुछ तो दवाई दे दो. Then they will say, डॉक्टर साहब कुछ तो होगा, अगर दिमाग की दिक्कत है तो कुछ तो ऑपरेशन करवा के हो जाएगा. न्यूरोसर्जन को should I go and approach? Then I need to tell them कि no, that's a neurodevelopmental problem. So what you have to go through is behavior therapy, occupational therapy, speech therapy, and other therapies, whatever is available in the setup. But this investigations will not happen, but will not help. So this is like common myth. देखिए CT scan करवा दो ठीक हो जाएगा. क्या problem है? So we need to make them like sit and understand that this is the issue.
So with this, I would say like counseling plays a very important role. Maybe the patient can be counseled if it's in a stage of counseling, or the family counseling, parents counseling is very utmost in this profession, I think.
The psychoeducation of family members is very important to understand what they know about it. Second, to educate them what they need to understand and how they need to approach and whom to approach and how they need to go and manage the children at their home. And in case of patient, see, when it is a child, then so there is no role of counseling.
Not options left much.
But when they grow up, then we can make them, if they understand a bit, then we can make them understand that you have this issue and you need to go for behavior therapy and all that.
Okay. What advice would you like to give to parents who have like unfortunately autistic kids, or maybe they are seeing signs and symptoms, still not diagnosed, but they are, after listening the podcast, many of the parents might have got some alarming signals and they could look for those signs and symptoms in their kids. What would be the advice to them?
First advice, don't search Google.
Great advice.
Second advice, visit a psychiatrist
as soon as possible.
Yeah. And then go for assessment and see whether your child is having those issues or not. Because sometimes what happens, things can be normal also, but there is like, it's a spectrum. So we need to assess so many aspects to reach a diagnosis, rather than just saying okay, the child is not making eye contact. The child may have social anxiety, so the child is not interacting in social gathering, so that doesn't mean the child has autism. So we need to assess overall, and then we can conclude whether the child is having autism or not.
Yes. The best thing, visit the doctor as early as possible. Okay, so don't do any such calculations on your own.
Yeah. And don't go for the Google assessments. Like I get adults who come and say कि doctor मुझे ADHD है, मुझे ADHD है. From where
they come with the diagnosis itself.
They'll come and say I have ADHD, because what, I am not able to watch this series. So I'm like, why? Other things are normal, fine, you're doing everything. Yeah, everything is fine, but I'm not able to, concentrate on the TV. So they are saying, and I don't know, there are some self-tests available online also.
I don't know either.
Yeah, they do such tests on themselves, and they'll come and say, I have ADHD, I think I need some medication, and give those medications. So,
oh my God.
Yeah, this self-diagnosis of ADHD.
This is a no.
Yeah.
Like, no self-diagnosis, no self-medications also.
Yeah.
Psychiatric medications should be taken on the prescription of a doctor. Yes. And with this, I would like to ask how early diagnosis helps in managing the quality of the life better in case of the patients.
Because the brain grows, okay. So what happens, for example, in normal person also, at the age of 4-5 years, what you can learn, it will be difficult when you grow up. In 60 years of age, what you can learn, and versus 6-year-old, what the child can learn, that's a different thing. So that's the age when you can learn a lot. So once that age is gone, then it's difficult to, make the person learn very simple things. And so in those cases, the earlier intervention, the earlier the person will recover.
Okay.
So we can't say that there is a cure for it, but definitely the quality of life is going to improve because the person will start speaking, start doing the daily activities, start reading. And there are autistic children also, like with mild autism, they have cracked so many exams.
And reached a great level also. Yes.
Even writers are also there.
And also maybe there are some persons with autistic symptoms, maybe mild, I don't know, just saying as a layman, like they could have a good marital relationship also. Yeah, there might be. Okay.
Definitely.
So any strategies that as a teacher, as a peer, as a maybe some relative, or maybe as a society as a whole, we could do to help those kids or help any other person suffering from mental disabilities to make the society to a better place to live in?
See, I believe that each and every drop of water you collect, it can one day make an ocean. So I think that, then spread the knowledge to others also. And along with that, if you find someone having those symptoms, then just go and talk to the parents. Try to help out and try to show maybe videos or some, reading material to explain them this can be the issue. So, and every child is different, like our 5 fingers, they have different sizes. So it's like, it's also, applied to the kids. Each and every kid of ADHD, autism specifically, they are different. So we need to approach to them as soon as possible.
We should handle them like with a unique way, and we should be more compassionate towards them also, as a society, maybe as a relative, anything, as a school, because they find really difficult doing the schooling. So yeah.
And even in metro also, if you find a special child and if you think that you can help, go and tell.
Yes.
Because people actually don't know. And I think we're doing a great thing in that, creating awareness. That is very important.
Creating awareness is the beginning. Okay. So are there any like reliable sources or organization you should want to name, if you want to, like who works on this field and parents can reach out, or they should go to a neuropsychiatrist doctor only, or are there any such self-help groups or any some organization working in this field?
See, National Trust is there, which is from the government. Like you can go there and search for NGOs for your children. So if the diagnosis is being done or you have doubt of diagnosis, you can go to those NGOs. And under National Trust, actually people don't know. They think that, oh, I have an autistic child, now my whole life is gone. But government is actually giving some remedies. Like you have Niramaya insurance scheme for them. You have some daycare centers. In National Trust, they talk about the legal guardianship also. And under Mental Health Care Act 2017, they have started, and the RPWD Act also. So they also, consider certain reservation in government jobs and even exams also. So some relaxations are given. Along with that, they get some amount of money, travel concessions, and Indian tourism, I think they can book hotels with some amount of discount. So there are a lot of things which government is giving to support the people.
Support those people.
And
nice.
Though for ADHD it's not that much, but for autism it's there.
It's there. Yes, with this also people can search for it and go, because in smaller villages or in rural areas, it's highly sometimes unlikely that they may not find the expert over there, so they could search and find the nearby NGOs working on this topic, and they can seek help.
If you go to National Trust website, you will find all the NGOs according to the states.
Okay, listed over there according to states. Yes, that's great. Okay, and with this we'd like to ask you a final piece of advice to all the listeners, to all the parents, or anyone maybe just for awareness, what they should do to take care of their mental health, their kids, everyone around them.
Oh my God, it can't be one sentence actually. So I believe that physical health is important, but it's our brain which, it's like the thing which controls our body. So it's very important to go for it. And whenever you have any sort of mental health issue, it may not be like depression, anxiety. No, I'm not talking about all those things. I'm talking about stress. You're not having sleep, you're having nightmare, you're having headache because of some stress, then just go and seek help, because all the mental health professionals are sitting there to help you all. Sometimes, and I will talk about this, National Crime Report Bureau. If you see the most suicidal thing,
Yeah.
so the most common cause is not depression or any psychiatric disorder, it's the family issues.
Oh my God.
So the coping mechanism of people, they are actually degrading day by
Yeah,
day.
they're really lacking the coping
Yeah.
skills and couldn't come up with the whatever stress they are having in day-to-day
Yeah.
life.
So the coping skills are very important. Sometimes we don't know how to react. People are very
Right.
impulsive nowadays.
Right.
Like mild argument, they are consuming Harpic, they are consuming organophosphates, and after that they have erosions in their food pipe, and they have some paralysis. So this is more traumatic. So for child, I will say कि in Hindi I have made this for one of the drama. So that is, हर बच्चा है खास तो उसे समझने का करे प्रयास.
वाह वाह, सच ए ब्यूटीफुल लाइन. थैंक यू दोस्तों हमारा पॉडकास्ट सुनने के लिए, और अपने मेंटल हेल्थ को आज ही से प्रायोरिटाइज करना शुरू कर दीजिए, बिकॉज इस शरीर का जो है रथ, और इस रथ के घोड़े का जो लगाम है वो है हमारा दिमाग. तो इसको ना भूले, ठीक है. अपने रथ को और अपने घोड़ों को कस के पकड़ के रहिए ताकि ज्यादा दिन तक स्वस्थ रह सके. हरिओम सभी को.